So I'm Denise. I'm from the Public Health team in Southend City Council, and we're here at Priory Visitors Centre. Beautiful day today, talking about Clean Air Day, and Clean Air Day is on Thursday.
My name's Sara Haddon and I'm employed by SABS and Healthwatch, and I'm the Community Connector Coordinator. So we've come today to meet with Denise to talk about how we can make the air cleaner and better for the people in Southend.
So we've arranged today, from Verna has let us come here to the Priory Visitors Centre to talk about Clean Air Day. So I'm from the Public Health team, and Clean Air Day is on Thursday, and we're just raising awareness around Clean Air Day, and and finding out what clean air means to people, how it's impacted on their health. I thought it would be really great to come together, looking at young, old, all generations coming together and talking about how we can make that difference.
My name's Sara Haddon and I'm the Community Connector Coordinator, and these lovely people are people that I've met out and about who now see themselves as community connectors. The thing that they all have in common is they either know somebody or suffer themselves with breathing difficulties. So it might be from work that they did when they were younger, it might be from smoking when they were younger, it might be from the environment that they've lived in when they were younger, or they might have cared for somebody who had a respiratory illness. In Southend, we now have 11 community connectors who share information about what it's like to live with a respiratory illness and to share information about the changes that they want to see happen. Meet with the decision makers to say, actually, we think we need this, or actually, this is what we want to see. So this is their role, and they've come along today to share their stories and talk to you about what clean air means to you and to them, and how we can change things moving forward.
Just after the half term, just before, he come home and he said, we're actually concentrating on increasing the oxygen levels around our school. We're planting more green plants that are going to produce this oxygen. So you're going to feel wonderful then when you come to pick me up. For sports day, just go where the plants are.
And I'm glad you're here today sharing that, because it's really good to hear, what's going
so
on with the schools.
Across all primary schools?
So yes, so with regards to the schools, so we have in Southend, we have 2 areas, and they're AQMAs, so it's air quality management areas, and we manage the air quality, so it's monitored throughout those areas. So they're going to be collecting that data. So once that data comes in, then we can look at, what the data's telling us, how the improvements can be made, what we can bring in to improve the air quality in those areas. Right. So in September is looking at an idling campaign, so looking at cars pulling up and when they keep the engine running. So trying to encourage people to turn off their engine while they're sitting in traffic.
Walking through the car park, especially in multi-storey car park, where people get in their car and now we all just check our phones. So you either turn your car on because you want the heating on because it's winter, or you turn your car on because you want the aircon on to cool you down. Meanwhile, all the fumes are going out into the car park, and then people with real serious respiratory illness has to walk past that to get to their car, and then end up coughing and spluttering because you've had to take in all of those fumes. So I think the idling campaign and in car parks as well as outside schools is really important.
Knowing what you know now about air quality, what would you tell your younger or older self?
Sorry, what was the question?
What was it like when you were young, the air quality? What did you have to do?
Well, either wrap a scarf around your, or wear a balaclava, go to school, that sort of thing. And we was always getting colds and,
That's right, yeah.
stuff like that.
And that was through the smog, was it?
Yeah.
And could you see the smog?
Yeah.
Yeah.
Yeah, you could see it. Yeah, it was in the air.
And it was it like really thick, like pea soup, like a
Could
fog.
be, yeah.
would
Fog,
be.
yeah.
Like proper fog. Yeah,
Yeah.
proper.
So
Oh,
could
fog.
you kind of see
If
your
someone
fingers?
didn't tell you it was that, you'd think it was fog.
That'd be
Yeah.
scary.
Yeah.
But it was actually pollution from
Yeah.
the industry, from the industrial
Yeah.
chimneys, etc., and so forth in the area, was
Yeah,
it? Or-
that's right.
Being a former engineer and welder,
Wow.
especially the welding side, yeah, you've got
So
your
you're
mask on
responsible.
for so you don't get archive and your eyes, but as soon as you're welding, you can actually feel the flux coming up under your mask, into your nose, up your nasally, and by the time you've finished maybe 2 hours welding and you take your lunch break, it takes you that whole half hour to get your actual breathing back regulated
Yeah.
to a normal intake.
Wow.
God, you can't imagine having to live with all that dirt in the air, would you?
No.
No.
But you never ever thought of staying indoors.
No, that's
No.
right.
But you're exploring all the time. During the 70s when I was young, we used to go out every day, all day out. You know,
That's
we'd be
it.
playing, we'd be running around everywhere.
Yeah.
We always wanted to be out.
That's
We
right,
didn't
yeah.
want to be in.
Well, what was there
But
indoors?
there was an issue about safety. In those days, you know, we didn't worry about being out all day. Our parents didn't worry about us being out all day.
That's
There wasn't that issue about the smoke anymore. It
No,
was
that
felt
had
to be
gone.
safe in every way.
So we've almost come full circle, haven't we? We've
Yeah.
gone from smog to it being cleaner in the 70s and 80s, and now we're back to all this exhaust fumes
Yeah.
and industrial
Yeah.
smoke and fumes.
And
Yeah.
interestingly, during COVID, I was saying about how that dropped as
Yeah,
well. And we
heavily
looked,
dropped.
we were looking at the air quality monitoring, you know, because I said about the areas of the AQMA areas, and you could see how much it's dropped, you know, and it was absolutely, when you saw the difference, and it's just like, but of course we've just gone back to that, you know, people are getting in their cars again, people are still driving, people are still continuing.
And I think that's one of the things, isn't it? That everybody says, well, what difference can I make?
Yeah.
But actually, if all of us eyes do something, it is going to make a difference, isn't it?
Do you think children and the younger generation are as aware as, or more aware maybe, as they are the future of the impact of things we're doing on air quality?
Both yes and no. Yes, we're aware, but we know absolutely nothing about it because it isn't talked about enough. And when lockdown happened, everyone cared. All the artists were making songs and poems about taking care of the earth. It was all over TikTok. It was over every social media platform. And now it's just not talked about. Though we are very scared for our future, it is all we talk about all the time. We're all very worried, but we don't know anything about it and we don't know where to find the information to change it.
So how are we going to educate these generations, Denise?
I suppose it is, isn't it? It's campaigns like this, and it's having the resources and the information, you know, to raise that awareness and talking, you know, and people thinking about, what can I do? And I know, because it is, isn't it? It's massive. Environmental issues are massive. And it's just, how, and sometimes you think, what can I do? How can I approach that? And it's having conversations, it's understanding, you know, and it's talking about, you know, our environment and what we can do and how we can support each other.
But again, when some people were younger, we didn't know the dangers of smoking, whereas now
It was healthy.
we yes, absolutely. But your generation do know the dangers, and yet people are still smoking. Sorry.
It's because of how it's been portrayed in TV.
Yeah.
It's like people do it, it seems cool and is seen as a stress relief. And our entire generation, everything is stressful. Social media is stressful, school is stressful. Every school I've been to, all the people I've talked to, the year 9 to 10, which were the people transitioning to high school from primary school, has always been the worst year because they had it really bad with tests, and they will currently be doing their GCSEs, and they have it so hard, and that everyone I talk to has some sort of problem with their mental health. It's
Well,
scary.
I was going to say the worst thing is vapes. I know people talk about the smoking, and I gave up as soon as I was diagnosed last June with COPD. I'm giving up smoking for that day. My mental health in the last month or so has really deteriorated. I've turned to a vape, but vapes are worse than smoking. You know, when I first gave up, I'd go to the bus stop, stand at the bus stop, someone could smoke around me, I'd pay no attention to it. There's vapes though, as soon as someone blows a vape out, I was constantly then, oh, I need to move away from this.
We can all take this back to the people who we work for, to those decision makers, like we've spoken about, the reports that I write, the reports that you write, for the young people as well, about how we can share this information much bigger and much wider, and that's what's so great about coming together like this. It really can make a difference, can't it?